Hello and welcome to another edition of Ask the Doc. This is the OHSU Parkinson Center. I'm Diana and I'm here with Dr. Kathy Chung. Today we're going to talk about cannabis. And I know that our Parkinson's community always likes to stay abreast with the current research, the current treatments, the current alternative therapies. And so cannabis is a big topic right now, especially since it's now legal in Oregon and it's widely available. So Dr. Chung, are there any medical studies with Parkinson's disease and cannabis?
Dan, I'm glad you asked this question because I get this question a lot in the clinic from Parkinson's patients and their families. But let me summarize what we do know. There have been about 3 randomized controlled trials using various forms of cannabis in Parkinson's disease. And of the 3, one of them was positive against dyskinesia, which is a side effect of long-term use of levodopa. The other 2, which were using capsule formulations of CBD or marijuana extract, did not show improvement in motor function or dyskinesia in Parkinson's patients. Although one did show an increase in quality of life, which that's important as well. There have been open label studies in which both the investigator and the subject know what they're taking. We consider this to be a little less objective and reliable information to use. There was an open label study that showed a significant improvement in psychosis. And then the smoked marijuana study showed improvements in everything: motor improvements, sleep, and in pain. So the bulk of the information is conflicting, I would say, and a little difficult to interpret because there's so little of it. And therefore, it's hard to make a definitive recommendation about cannabis and Parkinson's treatment.
Well, thank you, Dr. Chung. That was a lot of good information, although I can see how it could be hard to determine what would be the best course. Are there other information about the studies? Are there any side effects or complications that somebody might want to know before they try something like this?
Well, Diana, the information we have from those published studies is pretty positive in that there were very few adverse events associated with them. Most side effects are minor and include temporary feelings of dizziness or feeling a little spacey. The only concern I would have is that in other studies of marijuana use in patients, long-term use is associated with cognitive dysfunction. So if thinking problems are already a feature of your Parkinson's disease, I might be concerned or think twice about it, or at least keep it limited.
Well, that's a lot of great information. Some of it actually does sound promising. Mm-hmm. So what advice do you give a patient in clinic when they ask about cannabis?
The advice I give my patients in clinic is summarized as follows. The literature is still too small and too new to be able to make definitive therapeutic recommendations in Parkinson's disease. The upside is that the trials didn't identify serious side effects. So, for example, there were minor reports of dizziness or a feeling of spaciness, but these were temporary and resolved. So I guess overall, while it's difficult for me to make that decision, I'm at least happy to know that it's unlikely that people will harm themselves by using cannabis. I think use common sense, be moderate in the amounts that you're using, and be aware of any potential side effects you might be experiencing, and you can discontinue it if you do experience troublesome side effects.
Thank you, Dr. Chung. That was very informative.
Sure, absolutely.
If you have questions about your own treatment, please please feel free to contact your own provider that are more specific to you. I want to thank you for joining us again for another Ask the Doc video. We have other videos on our YouTube page. You can follow us on Facebook. If you join us on our website, there's all sorts of other educational videos. We tape almost all of our programs, and so there's more in-depth information. If you have questions that you'd like us answering in the future, please post on any of those sources and we'll see them. And we look forward to answering them in the future. Thank you.